Greetings from Indian Journal of Anesthesia. I, Dr. Iniki Sharma, will be presenting an article published in the recent September 2024 issue of Indian Journal of Anesthesia. It is titled Comparison of Aprepitant versus ondansetron for Prevention of Postoperative Nausea and Vomiting, a systematic review and meta-analysis with trial sequential analysis. Postoperative nausea and vomiting has a global prevalence of about 30%, affecting patient satisfaction and increasing the hospital cost. Effective postoperative nausea management is crucial, with various antiemetic drug classes including 5-HT3 antagonist, dopamine 2 antagonist, NK1 antagonist, corticosteroids, antihistamines, and anticholinergics showing different levels of efficacy. Recent advancement in antiemetic drugs and preventive strategies focus on enhancing safety and efficacy and prolonged effectiveness. A multimodal approach for PONV prevention in high-risk patients combining drugs with different mechanisms is recommended. So, this meta-analysis aimed to evaluate the effectiveness of aprepitant alone, which is a NK1 receptor antagonist, in combination with ondansetron or with dexamethasone and ondansetron compared to ondansetron alone or with dexamethasone alone. So this study focused on high-risk surgical patients, assessing the incidence of PONV, complete response rates, and the need for rescue antiemetics. So the primary objective was the effectiveness of aprepitant alone in combination with ondansetron or with dexamethasone and ondansetron compared to ondansetron alone or with dexamethasone alone. The secondary objective was incidence of postoperative nausea, vomiting, complete response rate, and use of rescue antiemetics. So the study design was a systemic review and meta-analysis. It followed the preferred reporting items for systematic reviews and meta-analysis recommendation. It was registered in International Prospective Register of Systemic Reviews in Prospero. The search strategy included searching of PubMed, Google Scholar, Clinical Trials Registry, and Cochrane Library database. The inclusion criteria included randomized controlled trial with patients more than 18 years, different surgeries under anesthesia, and comparing antiemetics aprepitant given at any dose with ondansetron in various phases of clinical trials. Studies with various designs and timings were included to evaluate comprehensively the aprepitant's role in postoperative nausea vomiting prevention. This study included RCTs published till 31st December 2023. The search strategy included use of mesh terminologies like aprepitant and ondansetron postoperative nausea vomiting with the use of or and Boolean operators. So data was extracted in Excel sheet and the statistical analysis was done in Review Manager RevMan 5.4. A random effect model was used for the meta-analysis of data. Funnel of plot was created to explore the possibility of publication bias. A ROP2 tool was used, which is a revised tool for risk of bias analysis in the randomized trials. The quality of evidence for the outcome was analyzed using the grade criteria, and to assess the robustness of the meta-analysis, a trial sequential analysis was performed for the outcome using the TSA program. So the incidence of PONV was defined as based on the patient's report or direct observation following surgery using numerical rating scale, visual analog scale, or the Rhodes index to quantify the symptom severity. The number of patients with complete response included total patients who did not experience vomiting and did not require any additional antiemetic medications postoperatively. Number of patients not needing rescue antiemetics included total patients who did not require additionally antiemetic medication following surgery. So this is the PRISMA flowchart. A total of 2,771 articles were identified from the databases. After screening and records sought for retrieval, a total of 25 articles were assessed. Full text were assessed for eligibility, out of which 12 were included in the systematic review and 10 were included for the meta-analysis. So this is the summary of the included studies. Now, in the results, this is the forest plot and the trial sequential analysis graph of aprepitant versus ondansetron. The first forest plot depicts the incidence of PONV, which is significantly lower with aprepitant. In the trial sequential analysis graph, the cumulative Z curve crosses the upper monitoring boundary very early, showing that further studies discussing this outcome is futile. Coming to the second forest plot, here it compares the complete response rate between the two groups, and it is found that the complete response rate is much higher with aprepitant than ondansetron. Again, in the TSA graph, we can see that the cumulative Z curve initially crosses the lower monitoring boundary, stabilizes, but it does not reaches the required information size. So we can say that this current trials are inconclusive and further trials are required to find out whether there is a complete response rate with aprepitant versus ondansetron. Coming to the forest plot showing the use of rescue antiemetics, which is significantly much lower with aprepitant than with ondansetron. Again, in the TSA graph, we can see that the cumulative Z curve follows the zero line, which shows that the current studies did not show any significant result between the two groups and further trials are necessary. Again, these are the forest plot and trial sequential analysis graphs between the aprepitant plus ondansetron group and ondansetron alone group. So we can see that the incidence of PONV is much lower with the combined group. Similarly, in the TSA curve, we can see that it has crossed cumulative Z curve crosses the required information size. So further trials are not needed to find out this outcome. For the complete response rate, the response rate is much higher with aprepitant and ondansetron combination than ondansetron alone. And the cumulative Z curve does not reach the required information size. So it can be said that the current trials are inconclusive and further trials are necessary. For the outcome of comparison between the no use of rescue antiemetic, it can be seen that the results are equivalent, and the Z curve, cumulative Z curve also follows the zero line. So further trials are necessary regarding this outcome. These are the forest graph depicting a combination of aprepitant, dexamethasone, and ondansetron with dexamethasone and ondansetron, where we can see that the incidence of PONV is much lower with the combined aprepitant combined group, and the cumulative Z curve also crosses the required information size. So further trials in this regard is not necessary. And the complete response rate, this is the graph, this is the forest graph showing the for no use of rescue antiemetic. So here we can see that the combined aprepitant combined group has lower rate of use of no use of rescue antiemetic than the dexamethasone ondansetron group. And the cumulative Z curve still does not reaches the required information size. So further trials can be done regarding this outcome. This is the risk of bias summary, where all the outcomes from the randomization process, deviations from intended interventions, missing outcome data, risk of bias from the measurement of the outcome, and in the selection of the reported results are low, except in two studies where there is some concern arising from the randomization process. So this meta-analysis included 12 trials with 2,729 patients focusing on strategies for managing PONV. The NK1 receptor antagonist aprepitant demonstrated superior efficacy compared to ondansetron in preventing PONV. Aprepitant combined with ondansetron or dexamethasone showed enhanced efficacy in multimodal antiemetic approaches, further reducing PONV incidence compared to ondansetron alone. This analysis revealed a reduction in PONV incidence, with aprepitant showing significant improvements across different surgical contexts and time frames. A 45% reduction in the PONV risk was noted with aprepitant compared to ondansetron. The preoperative administration of aprepitant, especially in combination with dexamethasone and ondansetron, exhibited sustained benefits in reducing nausea and vomiting, particularly in the first 24 hours post-surgery. Limitations of this meta-analysis include variability in methodology, patient population, and aprepitant dosages across the included studies that may have introduced heterogeneity. Further research is needed to address these limitations and enhance the understanding of aprepitant's long-term effectiveness. Continued investigation is recommended to clarify the true efficacy of aprepitant in diverse surgical settings and patient population, ensuring optimized PONV management strategies. Thus, from this systematic review and meta-analysis, we can conclude that aprepitant alone or in combination with ondansetron and dexamethasone consistently surpasses ondansetron in achieving a complete response. It results in lower vomiting rates post-operatively, and it reduces the need for rescue therapy within the first 24 to 48 hours after surgery. It also delays the onset of the first vomiting episodes, which leads to improved early recovery outcome of the patients. Thank you.